What is going on, everyone? It's MJ here. Episode 1. It's here. I'm super excited. Today's guest is a very special one. I'm glad he was the first one to kind of kick off this new journey. He's not an RN yet, but I have the utmost faith that by the time this episode releases, and has been out for a couple of days, he will have those 2 letters in front of his name. That being said, he does have an experience as a NAP, that's a nurse apprentice in the emergency room. So we were able to sit down and have a conversation about those experiences that we can relate to. I was able to offer some perspective from an ER nurse's view, and he was able to kind of share his view on a lot of the work he did as a NAP. I want to clarify that me and him had a conversation and had a lot of laughs about different things. You'll hear us laugh about certain situations, but I want to emphasize that we're laughing at those situations and not necessarily punching down on anybody in particular. I want to clarify too, there was a moment towards the end of the episode where it might have sounded like I was saying that a paralytic is given before a sedative in the situation of an RSI, that's a rapid sequence intubation. I want to clarify that that is not the case. In fact, it's quite the opposite. In an RSI situation, you'd want to give a sedative before a paralytic. And so I'm sure there's a lot of ER nurses out there that are hearing this and they're like, duh. But I like to think that there are some new grads out there and some nursing students that might be listening out. So I think clarifying that is very important. But without further ado, I'd like to welcome today's guest, my best friend, Matt, future RN.
Wait, is this a test run or what's going on?
No, we can just keep rolling.
Oh, okay. Okay. Man, I ain't gonna cap. I feel awkward on this shit, but
That's all right. Now I figured too, the first part of it we're probably gonna cut out because it's just such a. I didn't really know how I was gonna intro it to it either, but
I was like,
hey. But fuck it, bro. Take 2.
Wait, for real?
Yeah, let's just keep rolling. Bro.
Okay, all right, fuck it.
But all right. So, Breakroom, episode 1. My name's MJ. This is my best friend, Matthew Ablaza.
What's up?
Take 3. So it's my best friend, Matthew Ablaza. I'm MJ. This is episode 1 of the Breakroom, and the reason that I wanted him to be my first guest for the first episode was because I just think, ever since before he went into nursing school, to now him being in nursing school, I feel like our conversations like about nursing in general, after he gets off from a shift, after I got off from a shift, they just really capture the essence of what I want to get in this podcast, which is just like kind of raw, unfiltered humor and, stories about our experiences. But anyway, why nursing, bro?
Nursing. I will give a short story of my background. So, how do I want to do this? Actually, why nursing? Okay, so originally when I chose to go back to school, which was like, I don't know, mid-20s, I think, I needed to get my GPA up to enter a real program. And originally, I actually wanted to pursue rad tech, surprisingly.
Also, brother, you can talk to me.
Oh, yeah. Yeah, you're right. I can do that. Okay. Okay. All right. So. Oh shit. Okay.
Oh shoot. Sorry.
What were we talking about again? Oh, shit.
Also, my best friend has severe ADHD. He didn't take his medicine today.
Yeah, really bad.
And I have like slight ADD, so this should be a fun episode. But yeah, bro. No, like it is crazy because you just unlocked a crazy memory for me. I totally forgot you went the rad tech route at first. You were a medical assistant?
Yes.
Too,
yes. I needed a short program that would boost my GPA. So I said, screw it. I'm gonna go for MA school because it was like what 9 months, and it was like I don't know. I needed something really quick, but on the way of sorry, during the journey of MA school, I realized I really liked the profession, and I kind of just dabbled in the idea of like nursing. So I was like, I definitely don't want to settle here, and I also learned that ride tech was like kind of boring. I don't know. Compared to nursing, there's just so much you can do with the degree, which is why I chose nursing. That was a really big appeal to me in the beginning.
Would you say, and you can be honest too, that you're more of like a people person too? Like I feel like a lot of people that go that rad tech route, maybe they wanted to be in the medical field, but they also didn't want to interact with a whole bunch of people. Would you say that you figured, maybe I do want to interact with people, maybe I do want to provide a little bit more care, you know, like I guess like in depth, and that's why you kind of went the nursing route too? Or
So
you be real too and say you want a little more money.
Well,
okay
no,
too.
money is definitely a factor for sure. But I also am like a chronic people pleaser, so it kind of made sense to me. I'm like, you know, if I can't heal this, I might as well get paid for it, right? So yeah. I mean, I just feel like you ain't a real nurse if you don't have any people pleasing you. Or at least that's what I think. But anyways,
that's true, bro. Like I always envy, like I feel like I'm a huge people pleaser too, and we know that about each other. But I always envy the nurses that have the ability to kind of stand up for themselves and kind of put their foot down. Like, yeah, you know, when like a patient is like crossing any boundaries or anything like that. Do you feel like that's something like, I know that's something I got to work on. Do you think that's something you have to work on too, or does that come natural for you?
In certain contexts, yes. For me, like if I'm like really fed up with something, then like I will say something, but I have to be very careful with how I approach that situation, because sometimes I could come off as dismissive or whatever. But I try to stay as professional as I can, because But to go back to what you were saying of the whole people, like if I'm a people person, I think it just it's based on the context. Like I'm an introvert by heart, but if I'm like one-on-one with people, I tend to connect very well naturally. So, you know, when you're taking care of patients, it's naturally like a one-on-one thing. So I could really connect with them depending if I like them or not.
Yeah, you'll find out in this career, bro. There's going to be a lot of people you don't like.
Yeah, for sure.
Yeah, and I think it's really interesting too, because like I was babbling on earlier, like we just have like a lot of fire conversations, and I think since I've met you, like our personalities have just been really, I guess, synergistic. Mm-hmm. But it's really dope that while you were in nursing school, you got a NAP position too. So that's an apprentice in the ER. Mm-hmm. So it was really dope that we got to share like ER stories that, I mean, only people that freaking work in the ER can understand. Yeah. Like there's just some shit that you can't make up.
It's
but
very surreal down there, dude. It's ridiculous.
But I mean, we're going to have like so many different episodes where we can share different stories, but do you have a recent experience in the ER that's just been absolutely insane or funny that you share to people and they just can't believe that actually happened?
I got one story. I got one story. I hope this is not like HIPAA violation or whatever. Actually, I don't think so. I'm not mentioning names or anything, right?
Yeah, I think so.
Okay, we're good.
Because what I thought about that shit a lot before I started this podcast, but I feel like if we don't mention the name of the hospital, if we don't mention the patient's name or any like really specific characteristics of the patient,
okay.
I think we're safe from the big hips.
Okay.
But yeah, please.
All right, so this is the only one I could think of on the top of my head. So there is this patient. He is on the bigger side, so he does. Does that count as
how many kilograms?
I'm not gonna say that. I'm not gonna say that. So he was on the bigger side, so he had a hard time, like, like moving around. So I had so there was a call light, and he asked if I could help him take him to the restroom, right? So I put him on the wheelchair and
By
took him to the
yourself?
bathroom. Yeah. It was tough.
You just hit the code button just to get some damn help with this BP. This big patient.
Anyways, so as soon as I took him to the door to the for the bathroom, I noticed his chuck wasn't the cleanest. I was like, so I was like, hey man, like,
sorry.
I'm gonna go ahead and change your chuck while you're using the restroom, all right? And he started freaking out. He's like, no, don't, like, please, it's okay. I was like, okay, cool. And then went inside the bathroom, and then like 10 seconds later, I said, screw it, I'm gonna clean it up for him because I want to be nice, whatever. But as I was cleaning up the truck,
Oh no!
I was replacing it, or about to replace it, and then I lift his pillow up, and then I see like a 10-inch dildo under his pillow. So I was like, wow.
Yeah.
I didn't know how to react, so I kind of just dipped after that.
Sorry, bro. Let me just make sure it's still recording.
Okay. It's just dim right now, actually.
Oh man, that's crazy, dude. I feel like, I don't know, man. It's just been so long since I've worked in the ER in Las Vegas, and like sex toys being involved with different ER patients is kind of like a universal thing. But I feel like I've seen more in Vegas than I have like in Oregon or anywhere I've worked in, like California
City, bro.
That's funny.
Yeah.
So when you saw the dildo, you just dipped, or?
Well, I did tell my nurse, and then we both started cracking up. He's like, you know what? Just let it be, man. I was like, all right, man. That's about it.
Oh, that's funny. Do you have any like crazy stories? Like, I don't know, any cases that you've seen that are just kind of like, yo, what the fuck? Like, I thought this is only something like I see in like drama, medical TV shows, anything like that. I'll share one if you got to think about it a little bit.
Yeah, share one first. Maybe something will pop up.
I just remember one night, it was during like the later shift. I was working like 3 to 3 at the time. Mm-hmm. And it was a trauma, which we didn't see a lot in our hospital because it wasn't like a trauma one. And I mean, usually like gnarly stuff like that will come through the ambulance. But this dude walked in. Sorry. This dude walked in. This is not a funny story at all. But he walked in, and I think he was with his mom, but super pale. And they rushed him straight back. And I think I was working at RME at the time. Mm-hmm. And I mean, if you know anything about RME, that's like I guess in a sense, a little bit more of a chill shift, because you're not taking care of like anybody critical. You're just kind of like turning and burning really quick.
Well, I mean, do they run it? I don't know if it's different like hospitals. Like, what does the whole routine in your RME look like?
Well, back then it was pretty much like you were just taking care of like, well, you were supposed to just take care of like your kidney stones, your UTIs. Oh. You're super like treat them, street them, or like, okay, we treat them, we find out they need to stay in the hospital, let's try to move them into a bed as soon as possible kind of thing.
You know what? I apologize. I'm thinking from a NAP perspective. So that would be like, I'm thinking like ER tech, like in the lab and thing, but I totally forgot like your position's totally different. But go on, sorry.
Yeah. Oh, bring the mic a little closer too.
Closer? Okay.
But anyway, long story short, he's coming through the front, and he's pretty much like dead on arrival. I think he just had like enough life in him to like say like, yeah, something's wrong. And then we rushed him into one of our trauma rooms. And that was the first time I've seen I think it's called a thoracotomy, but chest wide open. And
that's pretty gnarly.
it's pretty gnarly, bro. And like I said, like we weren't a trauma hospital, so nobody really knew what we were doing. We were kind of all flustered everywhere.
Yeah.
And like I was a new grad, so I was telling Ann this too. But my saving grace was always like, if I wanted to look busy, maybe I just like wipe some blood or something, just to look like I'm doing something. While all the homies are like putting in IVs, putting them on the monitor, speaking to the doc. I'm like, yo, wait, give me a towel. Just look busy type shit.
That's hella funny.
But yeah, dude, fucking thoracotomy, his chest wide open. I remember looking right into it, and you can just see everything, bro. The cracked ribs, the heart, everything. I don't know what the goal was. I think eventually they wanted to like manually
Squeeze the heart.
Squeeze the heart.
Manually pump the heart. Okay.
Yeah. So, but yeah, that's probably one crazy story that I can think about.
Yeah, I don't know if I have anything like super crazy. I think it's more like most of them are just like, yo, like what the hell's my shift today? Kind of crazy, I guess. But
Right.
yeah, nothing to that extent. Like I don't really get a lot of like gory type patients.
Yeah, but just like I feel like just the fact of like the amount of work that they expect from you as a NAP or like a tech, because like a lot of the stuff that they have you do like as a NAP, like are the things that we have like our techs do, like a bunch of EKGs, a bunch of moving patients. Like, can you just talk about how crazy that freaking flow is of just like constantly moving patients, constantly doing EKGs, constantly having nurses going to you asking for another EKG while you have an EKG that you're currently working on.
I'm getting bad vibes. Just I'm playing. Yeah. So I want to say the very first time I got hired, dude, like 3 12s in a row. Oh my God, my whole body was aching. Like even after the first day, I was like, wow, like this is so different. So I don't know how it is at your place, but at my hospital, if I'm rotated in lobby, you got a vital for the patients and then revitaling and then EKGs, of course. Like on a super busy days, because I'm the only person doing EKGs, and we don't consistently have like an RME float because they're supposed to help with EKGs too. Dude, oh my gosh, it could be hell sometimes. Like I'd be like super dehydrated, very sweaty. It's like a whole workout.
You be doing
honestly.
electrolytes at work?
No, I'm gonna hop on that. You
Me
just told me about
Mando,
that. Yeah,
for sure.
Well, actually, I don't even know if it matters anymore because I did receive my ATT yesterday.
Congrats, bro.
No, it's not good, bro. 'Cause that means, I mean, it's good, but like that means I can't work at the hospital officially. Like that, I have to let go of my NAP position. That was the hospital policy. So I was like, shoot.
Nice.
Yeah.
Well, not nice. My bad. But I guess it's one step closer, bro, to getting those 2 letters. You know what I'm saying?
Yeah, that's true. But
Yeah.
bittersweet feeling. Like I'm sad because I do enjoy working, but also happy because I also don't enjoy working.
It's a nice little break.
Yeah.
Before they stick you with more responsibilities and shit.
For sure.
Yeah, bro. It's crazy. Dude, you met your now girlfriend at nursing school.
I did.
That's kind of awesome.
It was. I'm a big believer that things for happen. So I actually failed a semester. I failed a semester, and then there was this really cute Asian girl in my clinical group. I was like, all right.
Shout out Bree.
So I only had one class I was retaking, and oh my God, I'm so embarrassed to admit this, but it was community. Like, dude, come on. After retaking it, I didn't realize how easy that class was. But anyways, I failed that class. I was just so burnt out. I just kind of stopped caring. But anyways, moving forward, I only had 6 clinicals, and that means, okay, I only have 6 moves to make on this girl. And long story short, it worked out, and here we are, almost a year together. So
Nice, man.
big blessing for sure. Yeah, I was so committed to being single. I did not expect that to happen. When people said expect the unexpected, that's when it usually happens. They was not capping on that. It was not capping on that.
Is there, I mean, we've talked about it before, but I guess just for our audience, is there like now that you graduated with nursing school, I guess you've seen like a couple of different rotations, you've worked at the ER. Where do you see yourself working at and why?
I feel like I have a really good attitude towards this career, because I feel like a lot of new grads are just very picky with what department they want. For me,
Yeah.
I just care about building up my confidence, the resilience for dealing with conflict and BS that you have to deal with other.
So you'd be okay like starting like med surg?
Yeah, if I have to, because like at the end of the
Solid.
day, I'm learning and I'm getting experience, and that's just gonna set me up for like what I'm actually meant for later on.
Yeah.
Regardless if med-surg's not, it's not. You don't really need med-surg experience for this certain department. Like that doesn't matter. It's the fact that it's better than being jobless for 3 months, or man, this is a bad metaphor. I'd rather be in med surg for like, how can I put this?
You better brush up on those skin checks, homie. It's gonna be important.
Yes.
Is that shit intact or no?
Oh, dude, oh man, I should.
By the way, no knock on med surg nurses, bro. Like in Vegas specifically, and I'm like a lot of like East Coast nurses and stuff that I've met. Some of those dudes are like 1 to 6, 1 to 7.
Yeah.
And you gotta like juggle just like all this stuff. Sugar checks, medications, skin checks, all that, man. So new admissions. So
Yeah.
much respect for them. If you could pick and like, in like a hypothetical scenario where you just get to choose whatever unit you get to start off at, where are you going?
Oh, dude, ER 1000%.
Really?
Like when people say like if you have ADHD, and they were saying that if you have ADHD, you will thrive in the ER, and they were not lying. I just feel like if you have ADHD, like the fact that you're always like so busy, it like stimulates you. Like when you're stimulated, you just feel like you're able to like function normally.
That's
I
facts,
guess.
dude.
Yeah.
I just feel like with everything that you're getting hit and just having to like constantly reprioritize, it's like perfect for somebody with that brain.
Yeah. Yeah, dude. And I think like naturally, like ADHD people, they don't think about like the consequences. They just keep adding things to their plate without thinking about it. They're the type to just like, I'll figure it out later.
Yeah, that's true.
And I feel like that's a very that's like
an ER nurse kind of mindset.
ER, like that's like a theme in the ER. Like you got to do it now, figure out things later on. Like the most important priority right now.
Yeah,
is
dude.
This. Yeah.
I think like the biggest thing too that I remember, like one of my educators when I was like a resident in the ER, they were just always, it was kind of a joke. They were just like, oh, as long as it's good enough, right, ER nurses? Like, I guess that's, they just kind of harped on that. Like, take care of the emergencies. It doesn't have to be perfect. Make sure, like, they're stable. You take care of the most important thing. Continuation of care upstairs, That being said, I know it pisses off a lot of the nurses upstairs when we're bringing up shit shows. Like, metaphorically or literally.
Yeah, but it's just like
I swear they went in the elevator.
well, like, can you?
I'm sorry, bro. Bring the mic a little closer.
I just feel like you'll never understand until
wait, Matt. Sorry, bring the mic a little closer.
Oh shit! Did it drop?
Yeah.
There we go. There we go.
Sometimes. Okay. Humble beginnings, cheap equipment. This is good, bro. I feel like we're kind of easing into it a little bit. Yeah.
Yeah,
so.
like a little warm up. I don't really do well with like cameras, but screw it.
Yeah. I think you're doing good, bro.
Oh, okay, cool. Thank you.
Yeah. I think the ADD got the best of both of us in the beginning. I didn't know to laugh or listen or make sure the thing was recording or think of a story. Just kind of all over the place.
Okay,
but
look,
hey, episode
that's
1.
exactly why ADHD is perfect for the ER, because all the tasks feels like that. So that's I don't know. Like it's a really fun. It's a very unique department compared to others for sure.
Do you have a favorite? Do you have a favorite skill?
IVs.
dude.
IVs are probably by far my most favorite skill. Like, it's just
It just never gets old poking people, bro.
Yeah,
Poking
yeah.
people, seeing that blood draw, getting it in, you know?
Yeah.
And then like, how about the aura, bro? When like one of your
dude.
freaking coworkers is
Yeah.
like, "Hey, can you try? I
bro.
can't get it."
No, that's one of my favorites, especially like, you know, I actually feel honored like when a nurse like actually trusts me to like, yo, like, can you please get this patient
That's the
over here?
best,
Yeah,
bro.
like,
Or if you're not around and then they ask another nurse and the nurse is like, well, is Matt around?
yeah, no, like I feel like a god when you do that to me. Yeah.
And then you
like,
just walk out that room slowly. Look at the nurse. Yeah, 16 gauge left finger.
Yeah, bro. Yeah. Or like you get those
It's
patients.
positional though. Put some tape.
Or you get those patients that are just like emphasize like, look, listen, like I'm a hard stick. You might need you might need an ultrasound. Just letting you know. And then like, okay.
I am the ultrasound.
That's what I'm saying, bro. Like, or like if they say like,
Target
yo,
acquired.
maybe. Or like if they're like, yo, like maybe you should get a vein finder. I was like, bro, I am the vein finder. Like, you feel me? And it's like, I don't know, dude. Like, it just feels really good, like when some kind of doubt is there, and then you kind of just prove them wrong, and you just, I don't know, you just feel pretty good about that.
Dude, I feel you. Does it? Do you ever feel the opposite sometimes? Because I'm not gonna lie, bro. Like, I mean, 7 years of doing it, I feel pretty confident in my IV skills. But I can't lie. Every now and again, when I get that patience, that's just like, you're not gonna get it. You're not gonna get it. I start getting in my head. I'm like, maybe I won't get it. Like, does that ever kind of get to you if they're just kind of like telling you you need a vein fire, ultrasound, all that?
No, because at the end of the day, like, if it's harder, it's better. Pause. Hold on.
Yeah, if it's longer, it's better
if
too.
the patient has more difficult veins, I think
No
it's a
pause.
better opportunity to get better at poking, especially the super like sick patients with like, you know, like really tiny veins and stuff. It's just really good practice. That's how I see it. Yeah.
Yeah, dude, you're built different, bro. Yeah, sometimes it'd be getting in my head like that. I'm not gonna lie. Have you ever encountered? I mean, we all have in our years of nursing. The vets have, and we talk about it all the time in the break rooms or wherever. But have you encountered a doctor that makes your shift harder, or has been disrespectful to you in any way?
You know what?
And how do you handle that?
I feel like I'm really blessed to be working where I'm at because I actually have a very amazing work culture at my
nice.
place. Yeah, a lot of the doctors are very laid back. I mean, I don't know how the dynamic is with the doctors versus like nurses, but for the most part, it seems like a lot of the nurses really respect the doctors in my department.
That's
but
cool.
a lot of them are very laid back. They like to banter a lot. They're just really chill. You could kind of talk to them like as if like they're your homies and stuff. You know? Yeah, they're really cool. So
Every now and again, you get that doctor though. You call him bro. He's just like, eh?
Oh man,
You are below me. For sure, dude. Yeah, I mean, yeah, they be like that sometimes. And no knock on the docs too. There's plenty of really good ones out there. Yeah, I feel like if the doctors are chill with the nurses, you know, obviously if the nurses know what they're doing, of course, you know.
Well, speaking of that question, did you have anything with that kind of experience, like a bad experience, like with the doctors at your place?
Yeah, of course.
Oh, really?
I mean, I think you're probably bound to see it too once you do start, you know, like being a nurse. But, man, I'm trying to think of how to like frame this specific example. But like I remember, and I don't know why this one stuck with me for so long because I'm so used to dealing with just kind of angry doctors in general. And which, by the way, no knock on doctors because some of them are really fucking awesome. But this one in particular, I remember I had a patient. And it was a busy day, and I was actually feeling pretty good about like the way I was managing like my patient assignment and load or whatever. And dude, like my other thing too is like if there's an issue, like I prefer that you kind of step me to the side or into the break room or whatever, or like, you know, some other spot where it's not public and like talk to me that way, you know, and then we can like resolve the issue together. But he comes out of the patient's room walks to the nursing station where I'm at. Clerk is there, charge nurse is there, other nurses are there, and it's like, who's got the patient in room 15?
Oh shit.
Yeah. And I'm like, me? It's fucking embarrassing. Like, I mean, even being like a nurse for this long, it's still embarrassing when you're getting called out, especially if it's on some dumb shit. But
yeah.
Anyway, I'm sorry. But long story short, he comes out and he's just like, yeah, who had the patient in room 15? And I was like, oh, me. And he was like, we needed a urine. And he went to the bathroom. And I'm just like, and I didn't clap back. I just remember being super angry and just kind of like stating the fact. I was like, he went to CT. I did not see him go to the bathroom. Somebody brought him to the bathroom. Did you expect me to like make sure I was following him to CT so that I can see exactly when he was going to the bathroom and reminding him to give that patient, or reminding that patient that he had a sample, giving him a cup? Like, you just don't, you know what I'm saying? Like,
yeah.
But I guess in like hindsight, I mean, nobody's perfect, but I guess I could have like given the patient a cup and say like, hey, whenever you do need to go, like, we're going to need a sample. But still, like, the whole thing for me was the whole like calling out in front of everybody thing on something like urine. I can stand him up and he can pee again. It's all good.
That's the thing with the ER, because like there's so much going on, especially like, you know, if you have ADHD, like your distraction gets the best of you sometimes.
Yeah.
Like you just kind of have to be comfortable with like not being able to finish everything, even if that means like disappointing people.
Right.
So that's the thing that really sucks. Like you just have to like accept that, and I just feel like that's out of your control. I mean, like you said, you could have prepared better, yes, but like, you know, during that time you were probably focused like on other important things, I would assume, right? Like other tasks and stuff.
Yeah. I mean, and that's what it is too. I mean, like, I don't know. Some people are just not really going to understand, I guess, or maybe they're having a bad day and, you know, they get upset and it's just like amplified because of the way they're feeling or the way their shift is going. But yeah, I'm sorry about the urine, bro. I was kind of focused on making sure bed 14 next door wasn't dying of septic shock. Yeah, my fault.
Yeah.
Your kidney stone didn't get a fucking urine sample.
Like,
those are the worst, bro.
Yeah, I'm just like, bro, like
even if you are stupid, like as a leader, lift them up a little bit.
For real, bro.
You know what I'm saying?
For real.
Come on.
And even so, like it's like, bro, like I'm still learning. I don't know what I'm doing sometimes in the beginning. And like he'll just like make you feel stupid. I'm like, bro, like, what is your deal, man? Yeah. So like every time, like, I mean, I got used to it. I got used to just like brushing it off. I stopped caring. But every time I'm walking to the ambulance bay about to clock in, and every time I see a certain car and I see his car, I'm just like, man,
just that Arthur fist.
Yeah, the Arthur fist. I just like, dude, it's gonna be a shitty day today.
Yeah,
yeah. But I do respect that he makes sure things gets done. I respect that, but I just don't think he's a people person. He kind of throws a tantrum if things don't go his way. So yeah,
that always seems to be the give and take with those type of charge nurses. I've learned, like, usually their strength is going to be like they can get the flow going. You know, they're pretty good with prioritizing the really sick patients. They're good about getting the beds upstairs, like, you know, the stuff we expect from a charge nurse. But there is still that nurse aspect, and in the most like basic sense, it's like that empathy, not just for the nurses, but like your staff too. You know, I mean, what do I know? I mean, I've had a couple of lead and charge roles, but I just feel like if you can have both of those things, that really makes for the better charge nurse. You know what I'm saying?
yeah.
So,
I mean, go on. I lost it.
Man, this is good. Yeah, I was going to say, I didn't want to, you were like in a flow state, so I didn't want to remind you about that mic again, but.
Do you think it's this right here?
Yeah,
like,
it might be.
Okay.
So just try to adjust that so it just stays at a good level for you. Okay. You can even loosen it, bring it up a little bit more, and then tighten it again.
I think it should be good.
Okay.
Yeah, I think it should be good.
There you go. Shoot, what else, man? I mean, that was pretty good so far, but I don't know. Can you think of anything that you want to talk about, like as far as like nursing goes?
Um,
Oh, I got one, bro. So like, sorry, I literally asked you if you had anything, and then I was like, nope.
hey, it's all good, bro.
So shut your mouth. I got some. So like being my best friend for such a long time, you know that I'm like big on like, especially that we have this role where we're taking care of others, making sure we're taking care of ourselves. Do you kind of have like a game plan as to how you're going to take care of yourself once you get into that nursing role to make sure that you're going to work just ready to go, feeling great, ready to provide that exceptional care?
Yes. Well, for one, I'm definitely gonna upgrade my lifestyle. Not too crazy, but like, a reasonable, like upgraded lifestyle. Like, for example, like a massage every month type of deal, type of thing. Yeah. So that's gonna be one. Definitely staying fit at the gym again. I finally have time to lose all this nursing school weight. Jesus Christ.
Nursing school weight. Get you, boy.
Yeah, I gained I think like 50 pounds. Yeah, like 50 pounds.
Damn. It didn't get me that hard.
It got me pretty good, dude. It got me pretty good.
Speaking of massages, do you have that every unit's got that coworker that always just like massages you mid-chart? You got that coworker?
No, I don't.
Dude, wait till you meet him. I swear to God, every unit has that massager, bro. And it's always mid-chart, bro. You'd be literally just charting an assessment. You're on your Euro assessment. Yeah. Boom! You get an elbow right there.
The elbow dig, huh?
Yeah, I usually whisper something to you too, like, hey.
Wow, that would be really nice.
Yeah.
That would be really nice.
I'm telling you, bro, every unit's got that massager.
Oh yeah, self-care, right? Definitely maintaining my interest that I lost during nursing school, like watching anime, playing video games. So I finally have more time for that. I've actually been playing more video games lately, and it's been great.
Yeah,
I've been playing a lot more. Yeah, and then I have yet to explore other options because this is gonna be my first time really like actually being able to live life for the first time. So yeah, I definitely want to get into hobbies too, for sure. I don't know what kind, but that's something I need to explore.
Yeah, bro. I think that's the cool thing too about like just meeting a bunch of nurses, and all the different travel assignments and stuff. Is just kind of seeing what everybody's into, like, I mean, it sounds really basic, like nurses are just humans too, but I mean, some people are into some cool shit, bro. I was telling you earlier, I want to have him as a guest on this show in the future, but like I've met this dude that was literally like he's a nurse, but he's also like a Muay Thai champion. I'm like, what the fuck, dude?
Yeah.
Most people like crochet or like go to the gym. This dude's literally beating people's asses for a belt. So sick.
You know what? You just reminded me of something. I have this homie at work. He's a nurse as well. And he's been doing this for years, but jiu-jitsu, he's been doing that for like over a decade, I believe. And he actually does like personal training and stuff. He does like tournaments too. I don't know if he's like a champion or whatever, but I just think that's dope that like you have like a whole separate life like that outside of like nursing. It's like pretty badass.
Yes, yeah, that's the thing. I mean, like I kind of had that thought, but now I'm like really thinking about it. But like, I feel like this podcast too would just be like a super awesome, I guess, kind of platform for nurses to kind of just show how fucking dope they are. Like they just do a bunch of like cool shit too. I'm trying to think, man. Have you met anybody? I met a nurse that was a stripper before she was a nurse. I'd love to have her here too. Yo. Shout out you. You know who I'm talking about? Shit. Hope to see you here. But yeah, dude, just shit like that, bro. Some crazy personalities. I love meeting a Southern nurse, bro. Their accents are crazy. I love that,
Southern nurses are pretty cool.
Yeah, man.
And like, dude, they're so blunt. Like, they know how to set boundaries, man.
They're so blunt, but so kind at the same time, in like the most sarcastic way.
For sure, but like,
you know, honey, like that type of shit. Yeah. Was that Southern or Vietnamese? I don't know.
Sounded Vietnam, bro.
Oh shit, dude. What else, man?
Let's see.
Dude, what was the hardest class you had in nursing school? For us at UNLV, for some reason, it was OB. And I tell you this all the time, but they made that shit so hard for no reason.
You know what's funny? I still remember that conversation. I was at Amazon during that time. You were telling me about that story, and I finally experienced it, and I 1,000% agree.
You say
That
it's OB?
yes. I
Bro.
low-key got PTSD from that class.
Yes.
I almost failed that class,
But it's
actually.
almost like, why? Like maybe a fourth of maybe like 2 people in our cohort went to go do it.
Yeah,
You know what I'm saying?
I mean,
probably a little more.
I
but,
think
you know,
naturally,
still.
yeah, no, like I think naturally, like guys just don't care because it's not really their first choice of department, going like an L&D
Yeah.
or NICU, whatever.
Right.
But I don't know. I just think girls are a lot more smarter because it's their anatomy and they probably had kids already. Yeah, so it's just like, man, like why do I even need to? I mean, I know it's important, but I'm just like, dude, man, this is
Right.
ridiculous.
Yeah, my professor would always say the same shit too. Like she would always like preface, like even the beginning of the semester, remember this is going to be a very difficult class.
Yeah.
Not 1, but 2 patients that we're talking about now, mom and baby.
Yeah.
Like, all right.
I mean, speaking of that, PEDS was also fairly difficult, like the milestones.
PEDS is
and
tough,
yeah,
bro.
I was like, oh my God, like the different phases they go through as they age and stuff. And I'm just,
Yeah. Like I want to hear your thoughts on it too, but like even 7 years of working in the ER, you know, I'm obviously getting a little bit more comfortable with it, but still like I feel like I don't know, the approach that you take when taking care of the kiddos is really tough. It's a lot different. Just a lot of different like nuances and stuff. And the crying, bro. Like I don't know. Like it just stresses me out when I got to do an IV on a kiddo because I just know like dude, like some of those patient earplugs, can I get some for myself just for this intervention, please?
Okay, you're asking my thoughts on this, right?
Yeah, like how do you feel
look,
about it?
Oh man. Okay, look, I have nothing against kids. I'm just personally not that great with kids. Sometimes I'm awkward around them.
What's your
But,
approach?
like my approach on like how I view it.
Yeah.
Okay.
Maybe let's just try something and role play for like 15 seconds.
Oh God.
I'm
Okay,
like
I'll
a
try.
6-year-old patient. You're coming into my room. You got to do an IV.
Hey kiddo.
Hi.
Oh man, I can't do role playing, dude.
Me neither. I got really nervous.
I cannot do role playing.
I think we did pretty good. That was like
Oh,
5
shoot.
seconds. We got the intro in there. Oh, shit.
that just happened to me too, bro. You know what? I will share an experience though. So
Yeah.
this is my thoughts on it. So again, like when I'm in the triage lobby, you know, sometimes we get some PEDS patients, and you know, when I'm doing vitaling, and you know, like those oximeter sticker wraps thingy.
Yeah, dude. Sometimes they love it. Sometimes they fucking hate those
No,
things.
for sure. Like 90%. Yeah, like
It's just the sticker. Look
I
at
know.
the red light.
I'm just like, dude, like 90% of the time, the kids just like freak the hell out. I'm just
Yeah.
like, oh my goodness. I don't know. I just don't have the patience for like the crying, or like I don't even know how to like. I'm not good at like, you know, helping them like calm down and stuff. Like I don't know like how to like react and
Yeah,
stuff.
me neither, bro.
Yeah, and then I also had this patient. Well, it wasn't really my patient. I had to break a sitter at work, and it was an L2K patient, but it was a minor.
Yeah.
And you know what? Like
That's 12 hours of playtime, bro.
yeah,
You know what I'm saying?
yeah.
Yep.
So at first, like, so the break obviously like 30 minutes, right? So at first I was having a lot of fun with her because we were playing like house in her room, and we were like we were making like origamis and stuff, and I don't know, it was pretty cool hanging out with her. And then like that was after the first 10 minutes, I just got like super drained. I'm like, oh my God. Maybe because it's the department we're in, because like the last thing you want is like taking care of a freaking kid.
Yep.
Because like you're just so drained and tired from dealing like with other things. Like I'm not even a nurse and I'm already tired, like doing all this stuff. I can't
And
even
this was like
imagine.
15 minutes into breaking the first.
Yeah, so I'm just like, dude, oh my God. I can't even imagine like how like really drained you get when you really become like a nurse. Like I just got like a taste of it.
Right.
Like, you know, I still want a department though. But anyways, moving forward with that whole topic, yeah, I just don't think I could do PEDS because not only they get to deal with the kid, but you also have to deal with the freaking parents too.
Oh, that's a rough one, bro.
So it's like a whole package, yeah.
Yeah.
But I don't know. In my eyes, I just feel like at the same time, it is kind of the same because, you know, when you take care of adults, it's like, to me, it's like taking care of giant toddlers. The only difference is the giant toddler can AMA, the kid can't, you know? So it's like, damn, like, you get what I'm saying?
Yeah, no, for sure. Dude, and the parents thing was probably the thing that stood out the most out of what you said, but I think it's like one of the biggest examples of that, and like how sometimes like the parents might not understand what you're doing, and even though you might want to educate them to let them know like the importance of what you're doing to the kiddo, they still might see it kind of through their lens, and it's super emotional for them because it's like their kid. But like in this case in particular, I think it was a pretty insane one too. It was like a little kid that had to be intubated. We couldn't get a line on him, and then the caveat too, I don't know if I use that word right, but the crazy part about it too was that he had like some sort of really bad bone condition, so he couldn't do an IO either.
Okay.
So obviously no access, no bueno, because then we can't give the medications that we need to intubate the patient.
Oh,
which,
wait.
by the way, what are the medications?
I don't know, man. I will say farm is my weakest subject for sure.
That's okay. It's a paralytic and then a sedative.
Oh, sedative. Profilo?
Am I a nurse? Propofol.
Propofol. Okay, I pronounced that wrong.
But it's not propofol. When you're intubating, it's usually like etomidate is what they'll use.
Okay.
But like a paralytic, so just everything here stays still, and then the etomidate, so that you can, you know, put the tube down their throat. But
we had to intubate the patient.
Not us,
Oh.
but we will typically, I mean, obviously I think it depends on what state you're in, but you'll start the line and you'll give that medicine, and then you'll assist the rest of the team, which is like the RT and the ER doc, to intubate. But in this case, we could not start a line. We couldn't get access. We couldn't do the IO because of his
The bone condition. Okay.
So for the kiddos, and it was crazy because I remembered it too, as soon as they brought it up, they were like, oh, we got to do an IV on his scalp. But yeah, that was the thing. Like, that is a super standard normal thing if you can't get a line like on the extremities or anything like that. But the parents just start like freaking out. Do not put an IV on my baby's head. Do not poke the head. And then, like, you know how I go, bro? Like, the doctors, the nurses will literally take them aside, be super respectful. I know you don't want us to poke your baby's head, but if we don't, your baby could die. I know, but just do not poke my baby's head. No, there's got to be something else you could do. There's nothing we could do, bro. They had to intubate that patient without paralytics or sedatives.
Oh my goodness.
Yes.
That's wow. Okay.
Yeah. And I don't know if you can imagine that. I'm sure everybody else can, but you know, just a screaming
That's
baby
horrible.
with all their tone trying to resist a literal tube going down their windpipe. And that,
man.
yeah,
I feel so
it's just
bad.
crazy.
Yeah, that's terrible.
So
I think the other aspect of that department too is like another reason why I really don't want it is like if something really bad happens, like, you know, like dying or something, I don't know if my heart can take that, like, you know, like seeing a kid dies.
Oh, okay. I thought you were talking about adults, bro.
No,
Like,
no,
you get numb pretty
adults,
quick,
I'm just
brother.
like, all right, on to the next task, I guess. I mean, don't get me wrong, it's sad, but it's just like, I don't know, I'm used to it, I guess. I don't know.
Yeah, I'm trying to stay HR appropriate, but no, for sure. I mean, yeah, it's sad. It's depressing.
Yeah.
But yeah, no, you definitely get numb.
Yeah, numb is the right word. Like you still have empathy, but it's, you know, it's just like any other job you get into. Like it just feels like you had to continue doing your job.
Yeah.
Yeah.
And that's the crazy thing too, bro. Because I always wonder, like, I mean, you know, working in the ER for a while, you definitely see like a lot of death. You know, you see the reactions from like the family members.
Oh,
you know,
yeah.
And I don't know, it just like, it kind of just never really got to me. Maybe there were cases where it did, but I do wonder if that takes a toll on the nurse who's constantly like putting that in the back of their head just so they can continue to do their work for the rest of their shift. You know what I'm saying? Where they're kind of just like bottling up or like compartmentalizing or whatever the right psych term is called. Just like forgetting about it because they have to do the next thing for that shift. And I wonder if that takes a toll from doing that for years, that one day it just shows up in your life outside of work where you're like depressed and sad and you're like, I don't know what's going on. Like, you know what I'm saying?
I never really thought about that. Because me personally, like, I think it just really depends, like, how well you do with, like, emotions in general. Like, I feel like you and me, like, we're very detached at work. Like, we could still feel, but, like, we don't allow ourselves to, like, let it affect us type of deal, you know? I can see that, like, you know, if you make, like, a possible medical error, God forbid that ever happens, but if it leads to a death, then I could see how it keeps replaying in your head. Like, dude, like, I could have saved that patient if I did A, B, or C. But other than that, or I don't know, would you be in jail? I don't even know if you'll have time to reflect on that.
You'll have nothing but time, bro. You'll be in the penitentiary just like, damn, blood sugar was 30. Why'd I start an insulin drip?
Oh, God.
Oh, that is funny. Should we share med error stories?
Yeah, no, that's... Oh, wait, what?
I'm joking.
Oh. Man,
This is good, bro.
actually, why did you pick nursing? I should have just summarized it by like I just found a really big appeal in how much you can do with a degree, which was my reasoning for nursing. And I truly think I actually have the compassion and empathy and stuff. But
I think so too, bro. I think that's important.
Yeah, for sure. But like, what was your reason for choosing nursing?
I'm just laughing a little bit because I did a practice run for this podcast a couple days ago, and immediately Ann said money.
Hey, that's real. That's definitely real.
Now, if I'm being real, I think I went into nursing. Honestly, I wanted to be a PT at first, and I feel like, I mean, we can't lie. Like all my Filipinos out there, like there's gonna be a big push. Like the minute you get pushed out of that uterus for your parents to push you into some sort of medical. And it wasn't any different for my folks. My mom, and it's funny too, like none of them are in the medical field. They're business owners, but she kind of pushed me towards like being a PT, maybe being a doctor, things like that. And I think at the time I was like, I want to be a dietitian.
Damn, for real?
Yeah, but she was like, anak.
Not enough money.
Dude, I love her so much. It's Mother's Day tomorrow. And you know, they just always have like the best intentions in heart. And I think she just, as much as she saw that I loved like dietitian, nutrition, my health, not enough money, anak.
Hey, but that's real
take
though.
Care of your family.
That's definitely real though. I mean,
Yeah,
like
for sure.
Like now that you're here right now, do you have any regrets like choosing nursing versus not being
dude,
a dietitian?
Plenty regrets. No, I'm just kidding.
Oh shit! I was like, damn.
Nah, no regrets at all, bro. I mean, like I said, initially it was gonna be PT, and I think I knew at like an early college age, like in my 20s, that like school wasn't really my thing. And I think, I don't know, I think it has a lot to do with what you and I talk about all the time. It's like our ADD and just like sitting down, constantly reading a textbook, looking at PowerPoints, the anxiety from tests. Like, I don't know. I just don't think it was for me. And I saw nursing as like fulfilling that, like, I guess, dream for myself of going like that dietitian or PT route, but also not having to deal with like the multiple years of school. And to sum it up and not be super boring about it, I think nursing was a great choice because one, it was 4 years, sometimes 5. So really quick. And like, I got to take care of like myself, give back to my family. You know, she spoiled my girl with it. You know what I'm saying? Like in the form of like working in a specialized thing like the ER, going traveling for a while. And then, you know, everybody always says this shit and it's super basic, but it's true, bro. Like there's so much that you can do with that nursing license. Like, even if you end up hating the first thing that you're doing, you know, like right now, I'm not ready to hard launch it yet, but I have like a potential job lined up that I'm excited for. And I'm also doing like just IV home visits on the side. So
That sounds so fun, dude.
yeah, so shit like that you can do when you're finally feeling burnt out from, working in the emergency room.
I ain't gonna cap, dude. I'm not even a nurse yet, and I feel like a tiny burnout from the department already. But I just like that patients are in and out, in and out. That's a huge perk for me.
Yeah.
That's what makes it worth, in my opinion. Like, yeah.
Bro, I feel you on that. Like, I didn't realize too, like, that I love people as much as I do, but for some odd reason, I don't do too well with, like, I guess staying with a patient for a long period of time.
Yes. I think for me, it might be like an intimacy issue. Like, I don't know if the term avoidant, I don't know if that's a very common word, like outside. Okay.
Nah, bro. No. I usually make fun of you when you start to go this route, but I genuinely feel you when you say that, because I feel that in me. And I'm just like, okay, I love this patient. I'm vibing, but is the room upstairs ready?
Yeah. Like, I just don't like connecting too long. I like connecting, but not the entire 12-hour shift. I'm just like, dude.
Yeah, I don't know what it is, bro. Sometimes I'm like, I feel like an expectation to continue to be like this person that they love. And I feel like I'd rather just give them that in that brief period of time that we have. They go upstairs and then they just remember me as that person.
Yeah, for sure.
Because I didn't have an additional 6 hours to fuck up their perception of me.
No, like, honestly, this is how I see it. I think it has to deal with, like, when it comes to work, like, everyone has a customer service personality, right?
For sure.
So you're exerting that customer service personality. I mean, you're also mixing like your genuine side too, but for the sake of like a good experience for the patient, you want to go above and beyond with that customer service, right?
Right.
So I feel like when you're trying to maintain that performance, maybe it gets a little bit draining.
Dude, it can be.
Yeah, it can be draining. And for me personally, like, I start to feel a little weird when I'm connecting too much with that patient. Like, it gets to the point where, like, I kind of just want to avoid, like, hence the avoiding thing I just mentioned. But
getting too personal is just kind of funny. Can you imagine? You got a patient in there with an abscess. Oh, actually, me too. Just take off the scrub pant. Look anything like this.
But yes, it's just for me, it's just the whole like connecting too much, especially having them multiple days possibly if you're in med surge, like, you might have them for 312s, and like, there's always that one patient that kills everyone's vibes and might be on your run for who knows, like the whole 12 hours, all 3 12-hour shifts. So it's just it's terrible.
Oh, bro, can you imagine? I mean, I've never worked at a med surge unit, but I can imagine like you're going in, it's like day 3 of 3, and you get assigned that same patient that you had in day 2.
Yeah. Like, yo, I'm back, dude. Take your meds. I don't know how med surg works.
Let me see your skin. Have you heard that? I guess it's not an inside joke, but it's like a universal joke when it comes to med surg and skin checks.
No.
Okay, so I'm surprised you haven't heard it too, because it's such a big thing in the ER, which, again, no knock on med surg nurses. I have a lot of med surg friends and I fucking love them. But that's always the big thing, is that they are so thorough with their assessments that they're doing skin checks all the time too.
Oh, in med surg.
In med surg.
Okay,
right?
okay.
And so the running joke is like, you're an ER nurse giving a report to a nurse like upstairs in the med surg unit, and you're like, okay, yeah, so this, and that. I started the heparin drip. His chest pain was at a 9 out of 10. Now it's a 3 out of 10 after the nitro. Vitals look great. And I cleaned him up for you. I also gave him his insulin. And then they'll be like, is his skin intact? So, like, that has been like the longest running joke ever since I've started as an ER nurse, bro. And like, different nurses will like take that and milk the shit out of it. I remember one time I was drunk with a bunch of like, not drunk, I don't drink. I was hanging out with like a bunch of ER nurses in our San Diego assignment.
Yeah.
And my friend was telling me a story about how she was out at downtown and there was a patient that just like collapsed on the ground. And then her friend, who was a med surg nurse, like ran to go check on him. And he was like, make sure to check his skin, Jenny. So shit like that, bro. So
Oh, man.
I'm excited for you to hear your first skin check joke.
That is
once
actually
you're in there.
no, that's actually mad hilarious. I think just in general, like whoever could relate to inside like jokes in healthcare, it's actually quite fucking hilarious.
Bro, it's
like,
the best.
Yeah,
It's the best.
That shit's so fucking funny.
Like humor in the healthcare world is just like its own realm of like
Yeah.
different insiders that like only we understand, and
Yeah.
it's just so funny.
I think yeah, like
Like, all right, I'll give you another one. My homie, when I first started as an ER nurse, okay, this is bad. It wasn't me, but he gave report to a med-surg nurse upstairs. Gave her the whole report. I heard the whole thing because I was right next to him. And the nurse asked him, like, how's the skin? And my boy was like, it looks great. Skin's intact. And then I was like, you didn't check the skin, did you? And he made a joke. He was like, all right, let's go turn him. And he was like, imagine we turn him and there's a giant hole. And you just told that med surg nurse everything was intact.
it's like stage 9.
You can literally fit a fucking pencil in there. Probably a bag of Cheetos or something. It's such a big pressure.
It's like a portal.
You go inside that portal, you're at the floor. Oh. Your bed looks nice, man. Good view. Sorry, that's so
shit.
bad. Shit, dude. I think that was good.
I think that was good too. Yeah.
Yeah.
I don't really have any more topics I could think of.
But yep, that was episode 1. It's my best friend, Matthew Oblaza. He's going to be a nurse in 3, 4, 5 weeks, however long it takes. I just want to say I'm really proud of this dude. If any of our best friends are watching this or anybody that knows Matt, you would not have expected him to be here right now, because just a kid with no fucking direction who somehow just graduated with a BSN. He's about to be an RN, and he's going to make some great moves. So, bro, congrats.
Thank you, bro. I appreciate that.
Like, real shit. I am really proud of you. That's
Thank you,
awesome.
bro.
I love you. And thanks for being here.
Hey, likewise. Thank you for having me, bro. I love you too, man.
Avoidant.
All
Type
right,
shit.
cut.